Hello, my name is Islam Shireen. I'm an Associate Professor of Ophthalmology in Alexandria University, Egypt, and today I will discuss treating ROP by tape, fix, and inject technique. Our case was a preterm male infant with a gestational age of 29 weeks and the birth weight of 1,200 grams. The first fundus examination was done 4 weeks after birth, and it showed bilateral stage 3 plus in zone 2. The decision was to treat the infant with bilateral intravitreal injection of ranibizumab. Before the era of the anti-VEGF injections, we used to treat those infants with laser indirect ophthalmoscopy. That was a relatively long procedure taking 30 to 40 minutes, and we needed to give sedation or general anesthesia. Nowadays, we use the injections more frequently. It's done in less than 1 minute, and it's done under local anesthesia. We had two main problems during the intravitreal injection of those infants under local anesthesia. First of which is holding the body and the head of the baby, which was usually done by an assistant nurse or assistant doctor, but not infrequently they were afraid of holding the body and the head too tightly, which may lead to inadvertent movement of the head and the body. The second problem was fixing the eye of the baby. We used to use a forceps to hold the eye steady and measure the distance of 1 to 1.5 millimeter with calipers. Not infrequently, we lose the mark of the site of the injection, and if we use marking pen, this can lead to increased infection if injection is done at the site of the marking pen. We need to know that the injection should be done at the precisely determined distance. Going too anterior can cause traumatic cataract, and going too posterior can cause retinal damage. And because the need is the mother of the invention, we started to think that swaddling keeps the baby calm, and it's one of the proven methods to decrease infant stress during painful procedures. In addition, taping the head is a known way of fixing the head during adult eye surgery, and fixing the eye can be done with the forceps, just like we hold the food with the fork before cutting it with the knife. This clip demonstrates the tape, fix, and inject procedure. We tape the head to the bed using adhesive tapes. After taping the head and the body, we insert the eyelid speculum, put in betadine in the conjunctival sac, and then we use the calipers to hold the eye steady, as we will see now. Once you get the correct angle, you use the calipers both to measure the distance and to hold the eye very steady while injecting the drug. Injection of 0.2 milligram Lucentis was done in this baby. That's another example of another baby. We tape the head and the body to the operating bed using adhesive tapes. So one strap of adhesive tape over the body, holding the forelimbs in the anatomical position. And once the head and the body of the baby are fixed, the baby is completely calm, apart from minor movements which are not worse than when an assistant is holding the head and the body. And then we use the forceps to measure the distance and fix the globe, and we perform the injection. This is the microscopic view of another patient. So after inserting the lead speculum, the forceps can be used both to measure the distance and to fix the globe while giving the injection. A case series of infants were treated with this technique, and the results were published in a peer-reviewed journal, which can be accessed via the QR code. At the end of my presentation, I'd like to thank you for your attention. I hope you will get benefit from this technique.